Okay, good evening, good afternoon, good morning, everyone. My name is Vanessa Panettieri. I'm one of the medical physicists at Peter MacCallum Cancer Centre in Australia, in Melbourne. And today I welcome you, and it is really my pleasure to welcome you to the Young AFOM Awardee interview series, which will be sort of broadcast as part of the AFOMP International Medical Physics Week 2026. So I'm very lucky today to have here with me Dr. Shriram Rajurkar. Dr. Shriram has got the award for the Prof.Sung Sil Chu AFOMP Best Student Publication Award. So this is very prestigious award. So I just wanted to welcome you, Dr. Shriram. Really nice to see you.
Thank you, ma'am.
Yeah, do you want to tell us a few words about yourself and where you work? What's your role?
Okay, ma'am. I am Sriram Rajurkar. I am currently working as assistant professor in medical physics in Department of Radiation Oncology, NIMS University, Jaipur, India. And I am my research interested area in application of AI and machine learning to improve the radiotherapy workflow, motion management, and role of ethics of AI in radiotherapy.
That's wonderful. So, can you tell us about the publication that you've won the award for? What's the title and like a few words about it for
Uh,
us?
yeah, sure. It was the estimation of hard dose prediction model, especially in late breast cancer radiotherapy, in which we assessment the DIBH assessment DIBH by using the SVM model was used to predict the heart dose prediction. So we predict the heart mean dose before the RT based on the diagnostic image. So it was the our research work.
Fantastic, fantastic. In which journal did you publish for our for the people
Uh,
listening so that they can go and look it up?
yeah, yeah, JCMPM journal.
Fantastic. Okay,
Thank you.
so let's look a little bit at our theme. So the theme of this year, International Medical Physics Week, is sustainability in healthcare, and a little bit, the medical physics contribution. It's something that we need to think about. So, in your view, how can medical physicists contribute to building a more sustainable healthcare system? You want to tell us about it?
Uh, yes, ma'am. Actually, when we are think about the sustainability, previously we just think about the environmental sustainability, and this year they have been choose the theme for the sustainability is health care. This is really nice. And if we see the global statistic in the upcoming years for 2022 to 2050, it is estimated that around 16.3 million patient will need radiotherapy, and medical physicist is playing the important role in cancer treatment and even the diagnostic too. So medical physicists are playing role from the designing of the layout, then commissioning, routine work, and also they are performing the quality assurance at the interval. So that helps to enhance the lifespan of our linear accelerator. So that will be also directly, indirectly, it will help in sustainable healthcare, and aim of the sustainability to effective use of our resources that we are used for the clinical practices, but it should not compromise with the quality of the patient's care. So medical physicist has developing some clinical protocol like the ladder protocol and some clinical protocol that can utilize the least number of the scanning. So if you are utilizing three scan instead of, we can use the single scan for the our treatment purpose. And technological evolution is going on with respect to dates, and also the some innovation tool I have seen the synthetic CT and low dose CT that we can utilize for adaptive treatment plan. So we are reducing the patient exposure as well as the scanning time, and one scan we are also using less amount of scan, where if you're using three instead of only one is possible. So directly, indirectly, the whatever the energy is required, electricity is required, that is also reducing. So in this way, the physicists are playing the most important role in sustainability in healthcare, especially without compromising the quality of the patient care.
Yeah, that's a very good point. So you're seeing some of the technology, especially you're very interested in AI, for example. So artificial intelligence can help us reducing, for example, some of the exposures and so saving also the environment by, reducing the number of scans we do. It's a very, very good point. So in terms of personal experience and impact, so can you share how your work or research align with sustainability in healthcare and how you can see evolving it in the future?
Okay, so you are asking two questions simultaneously
Yes,
about routine work and clinical research.
exactly.
So in clinical point of view, in our department, we have implement some clinical protocols, bladder protocols, scanning protocol to reduce the number of scan in bladder patient. Also, we try to engage some plan of the treatment types. So we don't need to take number of scan to see the bladder. Also, we analyze the previous back data, that is our prospective data, how much MU we are using to prepare the treatment plan. And we
Mhm.
try to prepare the plan in lesser MU without compromising the healthcare quality of the treatment, with the achieving this all clinical goals with the lesser amount of MU is lesser, then beam on time will be a lesser. So if you are treating the 5 patient in a 1 hour, now we can treat 6 or 7 patient in a 1 hour. So time is reducing, energy consumption is reducing, and patient waiting time also reducing, and ultimately the KV and power consumption is also less. And in point of view, my research in 2023, there was one paper published in integral dose analysis. In
Mhm.
IMRT, we study the 5 beam and 7 beam techniques. So based on this, we can analyze the which treatment plan is better for the patient. So based on integral dose, if the 5 beam plan is better, so definitely it will reduce the treatment time also as compared to the 7 beam. And another, just we have discussed about the paper hard dose prediction model. So if we start the patient treatment and we observe that patient is not suitable for the pre-breathing techniques, maybe require DIVH because of the hard dose. So before starting of the treatment, we can predict the heart windows. So based on this, before starting the all procedure, we can decide whether the patient will go for the free breathing technique or DI based techniques. So directly, indirectly, this is also reduce the number of scan. And last year in the 2025, I went to IUPACM. I went through some sustainability lectures that was conducted over there. And after 2 days during the conference, I got this AFOMP awards. So I got motivated about the sustainability from the IUPACM and AFOMP, and I got some prize money from that award. So I utilized some portion for the tree plantation to our native place also. So that was the motivation from the entire community.
Fantastic. No, and yeah, that's a very good way of using your award. Very, very nice. So, in terms of the AFOMP and the AFOMP role, how do you perceive the AFOMP contribution to the medical physics community, and particularly in supporting professionals like yourself? I mean, you told us a little bit about what you've done with the award, but what do you think the AFOMP is doing for professionals like you?
Yes. When I went through some international conference, I have met with some people. They came from different LMIC countries, and maybe some of them not get motivation to attend, but because of AFOMP, they got some travel funding, travel award, and they able to attend this conference and get the exposure. Also, FOMP organize some webinars, some series, training program, and they are also very well maintaining the communication with our medical physics community. If any conference is going to launch, or if the early bird registration date is extended, like this, they are supporting to us and motivating to us. And we got so many expert talks I have seen on their website. So in this way, AFMP is playing a very important role for the medical physics community. Yes.
Yes, no, wonderful that it's doing that for all of us, yes, but it's good to hear also from the more, younger generation coming into medical physics. So what is your personal journey with the AFOMP? So has your association with AFOMP influenced your professional growth or opportunities in medical physics?
Yes, ma'am. Uh, um, from AFOMP, I received that award, and that gave me a recognition in our field. And from that recognition, I got several collaborative research opportunity in different sectors, even in interdisciplinary sector, from the not even the national, some international collaboration we have, research collaboration we have started. Some of in AI in ethics, rehabilitation, oncology, physiotherapy, and global health research. So such kind of the project work I have participating at the research at the global level, and because of this I got this opportunity. Even we build some network at the national and international level. So without the networking, it cannot be possible. So the this opportunity I get because of this AFMP things.
Yes, so it's given you the opportunity to collaborate and have more outreach and meeting physicists, but also other professionals from other countries and other organizations. Is that what
Yeah.
you think it's really the part that has given you a lot? Okay, and then, oh, the final question, which I really like because we like to always ask these questions. And what message or advice would you like to share with the younger generation aspiring to build a career in medical physics? So, if you were talking to the registrars, to the trainees, what would you like to tell them?
First, I my this will be my suggestion is that medical physicists have to think out of box.
Yes, I agree. Very good
And,
advice.
yes, yes. And also we should focus on the network building, because network building is always important. If you are facing some difficulty in any plans, the way of the planning is also different by physicist to physicist. You can learn from the network clinically. Also, you can form the research collaboration, multi-center research collaboration, because nowadays everyone are interested to enroll or integrate the AI in their research. But practical application cannot be possible from one center or one region. We need the diverse data from the diverse institute or diverse location. So for this purpose, network building is also important if you want to implement in AI tool at clinical practices. And we have to be open for the interdisciplinary research. If we think in the way of the sustainability in healthcare, so solely medical physics cannot accomplish fully contribute, because we need a different role and different collaboration. We have to think about the interdisciplinary, or may we need a transdisciplinary approach also, because the climates and everything. For this purpose, we have to collaborate with the planetary health expertise. So they will this collaboration will provide a good impact that will enhance the medical physicist role in sustainability in healthcare. So this is I want to express.
This is your message. It's a very important message. So networking, very, very important. Collaboration, very, very important. And learning from each other. I think these are great messages. So thank you very much for giving us the time and to talk and also for answering some of my questions. So I think we'll end up our interview here. So thank you, everyone, and goodbye to the next interview. Thank you.
Thank you, ma'am, and thanks